they said, okay, we don't know why, but you're never going to have a baby together. So you should consider adoption or egg donation or things like that. But at that moment, we were completely broken. We had nothing left for each other. We were on this emotional roller coaster, financial roller coaster. We were totally broke, and we were physically, mentally, and spiritually and relationshiply not doing amazing, and just didn't feel like we really were good people to become parents anymore at that point. And so what we did was we just took time off and from that journey and really worked on ourselves. We were living in Nebraska, which is beautiful and quiet compared to what we're used to. We were there for her internship, and there are hundreds of miles of beautifully groomed bike trails, and we just spent so much time together in nature. And we started to do things like yoga and acupuncture and meditation, eating better, relating better, earning money and not spending it all, and on drug treatments. And we eventually, about 9 months after that, moved to Los Angeles. And once we were settled in, we thought, let's start to explore again. What are our options here to become parents? And we found out we were pregnant.
Hey y'all, and welcome back to another episode of the Birth Lounge podcast. All right, what'd you think about last episode where I talked about my own pregnancy? Surprise! Baby Hee is joining the crew. I'm so excited, you guys. This has been such a fun journey so far, and it has just been honestly way better than I ever anticipated. Not only do I feel amazing, but you guys have been so sweet. Obviously, people love pregnancy announcement, but the love and outpouring of support that I got when I shared that we were expecting a baby this year is just honestly, it's overwhelming. It just blew me away. I've tears in my eyes right now thinking about how grateful I am for the community that I have in you guys and on the podcast and on our socials and in the birth lounge. It's just I am so lucky and so grateful to be surrounded by such amazing humans, and I just wanted to spend a little bit of time to extend my deepest gratitude to you guys. I feel the love, and I'm super, super, super excited to share this journey with you guys. Along with that, I'm so excited for our guest today because he's also someone who I'm going to be sharing this journey with. If you're not familiar with Dr. Elliot Berlin, he is an award-winning prenatal chiropractor who actually blends chiropractic care, bodywork, and obviously advocacy in everything that he does. He's also a childbirth educator, a labor support body worker, meaning he actually does chiropractic care for you while you're in labor. In addition to all of that, as if it was not enough, he's also a filmmaker. And so Dr. Berlin is actually going to be following my pregnancy throughout the time that I'm pregnant and during our birth so that we can show you real and raw footage of what it's like to have an informed and confident and empowered birth experience. Obviously, no one knows how birth is going to unfold for any one person. But what we do know is that when you do the work, you can stay in control of the decisions made. And that is what I vow to you. I promise to you to show you the real and raw moments of being pregnant, what it's really like, transparently and honestly. I'm going to let you inside my thoughts and my concerns, my fears, my joys, my happiness, the wins, the things that keep me up at night, the questions I have, the practitioners that are helping me on this journey. I want you to truly be able to see what it's like to be able to be in control from start to finish. I told you last episode that I feel so in control. I feel so calm and I just feel so grounded in this journey so far. And I hope that continues. But should it not, you'll be right there alongside me because Dr. Berlin is going to document it. And I want you to really be able to see the ebbs and flows of a true, unfiltered pregnancy. Also, I'll take you along for my home birth and then again, maybe some pit stops in postpartum. Not only is it an honor to have Dr. Berlin documenting our pregnancy so that we can share it with the world, but it's even more of an honor to have him on the show today. Today, in particular, we're going to talk about chiropractic care in pregnancy, how it's often dismissed as alternative medicine, even though it's quite a critical care point to having a healthy and strong pregnancy. We're going to dive into our nation's C-section rates and how can you benefit from chiropractic care. What about pelvic asymmetry and getting babies in the right position for labor? Which leads me to the question of breech babies. Is that something that chiropractic care can help encourage babies to get in the right position? Can it help you avoid a breech baby altogether? Finally, we're going to dive into more controversial topics, of course, like why the obstetrical model of care may not value chiropractic care the way that it should. What kind of financial incentives exist inside of hospital-based maternity care, and why our country has the highest maternal mortality rates in all of the developed world? It's not because birth is inherently dangerous. So what kind of systemic failures are at play? As the founder of the Informed Pregnancy Project and the host of the Informed Pregnancy Podcast, which I was just a guest on, so check that episode out, I can't think of anyone more qualified to come on the show to help me tackle these topics than Dr. Berlin. So without further ado, Dr. Elliot, welcome to the show.
Thank you, Hee, for having me. It's amazing to be on your platform.
Yeah, thanks for coming on. You have been a long time wish list guest for me. And so it's such an honor to have you here. And I'm really excited to dive into chiropractic care. I personally go to a chiropractor, so I'm always posting about it. I'm very excited to share about this with my community. But before we dive too much into the nitty gritty and the science behind chiropractic care and pregnancy and the positive outcomes of that, I'd love to hear a little bit more about your background and how you actually combine chiropractic care, body work, birth advocacy to help women actually have an informed pregnancy.
That is a lot of combining. And I don't play a lot of video games, but my son does. And I see sometimes he'll be playing a video game and a big sign will pop up with an arrow and it'll say, go this way. And that's what's happened to me in life. I was 7 years old. I walked into a building in Manhattan. I grew up in New York City. I walked into a building in Manhattan and I witnessed a CPR class in progress. And I was like mortified. I was like, what are they doing to that poor lady with no arms and no legs? And then when they explained to me that you could use your body to be somebody else's heart and lungs until advanced medical care can arrive, I like a light went off and said, you're going to do something in healthcare. You want to help other people in their time of need with your body. And so I started, I think when I was 10, taking American Red Cross classes like CPR, first aid, responding to emergencies. As a teenager, 15, 16 years old, I was teaching for the American Red Cross those classes. When I was 17, I took New York State emergency medical technician training. And when I was 18, I started working in ambulances and emergency rooms. And at 19, I was enrolled in college. I was studying pre-med. I was on track to be the greatest something or other surgeon there ever was. And also that year, my father unfortunately died suddenly from a medical mix-up, partially from a medical mix-up. And I took a step back. I finished studying healthcare pre-med and I took a year off and I just realized I love and respect medicine, drugs, surgery, and all the innovations in healthcare, but I realized every intervention has potential side effects, downsides, and I didn't want to be on that side of healthcare anymore. And so I took that time to study alternatives and complementary forms of healthcare, many of them, and I fell in love with the combination of chiropractic and massage together because we have a deeply intertwined musculoskeletal system. So I went to school for both of those, met an awesome girl, and she was studying to be a psychologist. We got married, and at the end of grad school, we were like, let's have a kid. And so we followed the instructions for making a child, and sadly, no child came out. And that threw us into many years of a long fertility struggle, at the end of which all the assistive reproductive technologies did not help us. And they said, okay, we don't know why, but you're never going to have a baby together. So you should consider adoption or egg donation or things like that. But at that moment, we were completely broken. We had nothing left for each other. We were on this emotional roller coaster, financial roller coaster. We were totally broke, and we were physically, mentally, and spiritually and relationshiply not doing amazing, and just didn't feel like we really were good people to become parents anymore at that point. And so what we did was we just took time off and from that journey and really worked on ourselves. We were living in Nebraska, which is beautiful and quiet compared to what we're used to. We were there for her internship, and there are hundreds of miles of beautifully groomed bike trails, and we just spent so much time together in nature. And we started to do things like yoga and acupuncture and meditation, eating better, relating better, earning money and not spending it all, and on drug treatments. And we eventually, about 9 months after that, moved to Los Angeles. And once we were settled in, we thought, let's start to explore again. What are our options here to become parents? And we found out we were pregnant.
Oh my gosh.
That's what I said. And then every 2 years, another baby came out. And it's like we couldn't turn it off. We have four healthy kids, thank goodness. And they're great kids. And when we opened our mind body practice, we opened it with general health and wellness as the center. But we always had an eye on trying to help people boost their natural fertility. And sometimes medicine has a role, and sometimes nature has a role, and sometimes it's a combination of both. And why not maximize what your body can do? And the first year, I guess a couple of babies came through there. And then after that, it just snowballed. There were babies everywhere. And that's how we ended up that another big arrow went off to go this way. And we started doing a lot of prenatal care. And eventually somebody says, hey, this is awesome how you take care of me when I'm pregnant. Can you do this while I'm in labor? I'm like, I don't see why not. And then both of us end up becoming doulas, sort of specialty doulas, a bodywork doula for me, and a sort of a doula who can help people who need a little bit more of a mental health kind of doula. If you're OCD, giving birth in a hospital sort of thing, which is what my wife really did her doula work, and then postpartum and babies, and just more arrows going off saying, go over this way. So that's how he got into the combination of chiropractic, massage, and with my wife, mental health, very specifically around pregnancy, birth, postpartum, and parenting and babies. And along the way, getting into realizing there's a void in great information, compiled these easily digestible, reliable information, and figuring out how to do that and deliver it in ways that it would become accessible to a lot of people.
Oh my gosh. Okay. I have always felt very connected to you and Alyssa through your podcast and your platform, but this just gave me chills just thinking about how similar our journeys are. My husband and I have not struggled with fertility, but I became a lifeguard at the age of 15. I was in the training manuals when I was a small child because my grandfather helped publish the training manuals. And so my love of healthcare and taking care of people and helping people be informed about their bodies is from childhood as well. And then you talk about these arrows in life. I talk about them as doors that were shut in my face, where I was trying so hard to go down this path and I just could not make it work. I couldn't get people to email me back. I couldn't get my foot in the door. I couldn't find an organization that did X, Y, and Z. And it always felt, what is happening? Why is this door being shut in my face? And it was because something better was on at the other side of a different door. And oh my gosh, I love that so much. It For me, I think we are the people who were meant to be in this kind of realm, in this industry. And I love that. Thanks for sharing that
I
so
was going to
much.
say, now that I understand a little bit more about your background, it makes sense. Like your passion that comes out really makes sense, and your enthusiasm for what you're doing makes sense. And also, when the door's been shut and you kick it open, that just makes you stronger. And like you said, I think my wife and I both will look back and realize the time that we did become parents was probably the ideal time. And if somebody would have given us a crystal ball 8 years earlier and said, don't worry, this is when it's going to happen, we would have had a much cooler 8 years leading up to. But I don't know if we would have been as strong as we are. We came out of it with an unbreakable bond in our relationship and just a fervor for parenting that I don't know that we would have had it come easy.
Yeah. Do you think that it made you better parents to have, I don't want to say gone through that struggle, but to have gone through that period of time where you had to unlearn and relearn yourselves and unlearn and relearn your relationship and unlearn and relearn the thoughts and beliefs that you guys held?
I think in ways it does. Even just at 2 a.m. when the kid is screaming, and my friends would describe, why did they have to wake up at 2 a.m. and scream? And we're just so happy to hear them and want to go see them, even though it's 2 a.m. I think in ways like that, now they're older, they're teenagers, but I think it follows all the way through. We just have a deeper, greater appreciation for them than we would have, I think, had they just shown up on the doorstep.
Yeah. Oh my gosh. I know there are so many listeners that have very similar stories and are feeling very deeply what you're sharing and maybe are still even on their journey. So, you guys, if you're listening and you're like, I haven't had my baby yet, my baby hasn't found me, I hope this gives you some hope that your perfect baby will find you. I promise. Oh my gosh, you
Oh,
guys know I say that all the time.
crystal ball. I wish I had the crystal ball.
Yeah.
But yeah, you can feel. I just had a patient because I also do energy work, and I just had a patient who's on the journey, and it was so clear to me during her energy work that there's already a baby assigned to her.
Oh,
I felt the baby's presence. I could almost feel characteristics of the baby, and I didn't want to overstate because I don't know how long it'll take to get there. But it was just so clear that the baby's energy is already there, and it's just a matter of time.
oh my gosh. Hey, if you're not watching on video, I'm already tearing up, you guys. I cry a lot on these shows, but I just love it so much.
Sponsored by Kleenex.
Yeah, seriously. Oh my gosh. All right, let's shift to what we're here to talk about, chiropractic care. So, I'm a huge fan of chiropractic care. I go every week. I love my chiropractor. They are just staples in my health care. They work very closely with my acupuncturist and my functional health doctor and my midwife. And I feel very lucky to have found the chiropractor that I have in Boston. It is often revered as alternative medicine, and so often I find that mainstream medical providers almost poo poo it or slough it off as you can, but who knows if it's going to work. Can you tell us a little bit about how you deal with this skepticism and maybe what people need to know about the science behind chiropractic care? I can tout it from the rooftops all day, and I do, but I think hearing it from a chiropractor that has so many years of practice and has actually helped so many pregnant women have amazing births would be much more beneficial than hearing he talk about it.
Sure. I have, first of all, let's go back to the 1960s and 70s. It's as if two car manufacturers came out at the same time and were producing all these cars, and you asked one of them about the other one. They're not going to have anything pleasant to say about the other car. Their car is amazing, and it has all the whistles and bells that you need, and the other car is far inferior. And that kind of sort of competition got a bit ugly. And medical doctors and doctors of chiropractic really were not on the same team at all. I'm pleased to say that at least here in Los Angeles in today's day and age, there are the younger crop of both medical doctors and chiropractors are, I think, more eager and open-minded towards working together. And in my personal opinion, again, my personal story with medicine aside, I really feel amazing to live in a time when we have very cool medical innovations and grateful to the people who spend decades learning and perfecting those skills to be able to deliver them well. And so I find that our patients get the best care when we're on the same team, when we work together. That team that you mentioned, he is amazing. And if you add a medical doctor to that who's on board, then it's really even a deeper complement of practitioners that all come together to give the best of all worlds to our clients. So I find that happening here. And something that's nice is that a lot of our patients are medical doctors. I regularly have medical doctors, sometimes OBs, and in the field that we're working in, which is also really nice, and sometimes in other fields, but they'll get pregnant or have a baby and they'll come in for care. And they're much more open-minded than even 20 years ago when I was in school. It's really great when we can work together. And when you pick your practitioner, that might be something that you're looking for. Are you open-minded to working with other practitioners? Do you know anything about it? I think also a lot of times when you don't know, you just say, no. Can I go see a chiropractor? No. But what do you know about chiropractic? Nothing. So what are you judging that based on? And I think that when you have a practitioner who knows what they know and knows what they don't know and gives you an honest answer based on knowledge, including, I don't know much about that, I can look into it or recommend someone for you to talk to. That's the kind of practitioner that I want to be, and that's the kind of practitioner that I want to see. Chiropractic also is a little confusing because it is true if you go to 10 different chiropractors, you could have 10 very wildly different experiences. It's not uniform, like you go in and it's the same thing everywhere. One thing I will say is what we do have in common is we are looking for restrictions in the skeletal system in the body. Wherever two bones come together, they form a joint, and there's supposed to be movement between those bones around the joint, sometimes more movement, sometimes less, depending on the joint. But when it becomes restricted, it creates problems for you. And a problem could be something that you feel, like a loss of range of motion. It doesn't move well, or pain. And it could be a problem that you don't feel, just the creation of a static environment where you're supposed to have dynamic movement. And what chiropractors do have in common, we love looking through the body, especially the spine and pelvis, but really any place two bones come together, looking for these restricted joints and releasing the restriction and restoring motion between the bones around the joint. When you get that functionality to increase, lots of things can happen. One thing is you the restriction that you had goes away. Now you have full range of motion. The pain that might have been there goes away. Now you don't have pain. The dynamic improvement may not be evident immediately, but especially when it comes to pregnancy and childbirth, it has very big implications. But the other thing right before I get to that is just like if you have compression on a nerve, that nerve might be a nerve that transmits pain information and you'll feel the pain, but it could be any nerve. The nervous system controls the function of every cell and organ in the body. So let's say it's a blood pressure nerve and it could be going up or coming down. It could be coming to the central nervous system or coming from the central nervous system. So if it's a data nerve, it's telling your body what your blood pressure is. Your body is telling your brain what your blood pressure is. If that data is off, then the body's response will be off too. So if the message is skewed and comes in that the blood pressure is low, your body's response to that low blood pressure reading will be to raise your blood pressure. But it's bad information because that nerve is not working well. So should you be able to restore normal communication without irritation to the nerve, and now the brain gets the right information about the blood pressure, it can regulate the blood pressure better. That's just one example. It again controls every cell function and organ in the body. So the implications are huge. When it comes to childbirth, your pelvis is not one big solid bone. It's
Not
a bunch of,
stationary.
it's not stationary. It's a bunch of bones connected by ligaments and cartilage. It does have a lot of dynamic movement built into it. It can expand and contract in different directions to accommodate or even facilitate the pre-birth positioning and the movement of the body through the pelvis during delivery, during childbirth. If where those bones, those pelvic bones come together, there is little to no movement, or the soft tissue in those areas, the muscles, ligaments, tendons, fascia are stiff, tight, and rigid, you're not going to have that kind of functionality. And so if there is maneuvering that needs to take place, it's much more challenging because your body is resisting that maneuver instead of accommodating or facilitating it. And so it may be that your pelvis feels fine, but if you don't have the functionality, that can create implications for you when you're trying to give birth. if we can restore it, first of all, most people, even if they're feeling fine, once we get the pelvis moving better, they feel more than fine. They feel even better. They didn't realize that they were feeling restricted. But also, having a well-functioning pelvis suits you well when you're in the final stages of pregnancy or giving birth.
One of, or I guess two of the things that I've noticed with my own personal experience with chiropractic is you talked about range of motion and strength. I have noticed, so I've struggled with a weak pelvic floor, and it has caused me to hold my pelvic floor up, which has actually caused me to have hip pain. And my chiropractor has said it's weakness in your hip that follows the weakness in your pelvic floor. So I've been doing I guess I didn't mention my PFPT either, but my chiropractor and my PFPT work together and they've come up with a plan and they've completely resolved my weak pelvic floor and my weak hips. And now I have absolutely no pain. The second thing that I've noticed is I do not get sick. My immune system is so strong and I just can't say that it's anything other than the chiropractor going regularly to the chiropractor. Now, do I think that it boosted my immune system because I go to the chiropractor? No, but I think what you're saying about regulating that nervous system, getting my body back into alignment so my body isn't having to compensate in other ways and isn't getting that bad messaging in through a misaligned body, it has made my body just work well.
Yeah, first of all, after chiropractic adjustments, your immune system does kick into a higher gear. There's
Oh,
a bunch of studies that show that, but also in create more white blood cells and the things that you need. With massage, we do lymphatic work, which is very immune boosting. I think that on a bigger picture, if your body's stuck dealing with malfunction, then it is not in a good position to deal with readiness or immunity to attacks from the outside. Once you get rid of that malfunction, it's much more suited, it's more capable to constantly be monitoring and dealing with appropriately the threats from the outside, like virus, bacteria, fungi, and things like that. When it comes to working with a physical therapist, I there's another group of people that sometimes don't get along, chiropractors and physical therapists, because there is overlap and competition. If you go to Honda and you ask them about the Toyota, they're like, "Oh, it doesn't have this and it doesn't have that." We do that and buy our car. Or if I go into any of them and be like, "I'm thinking about just biking to work every day," they will give you all the reasons why that's not a good idea and none of the reasons why that is a good idea. And so there's sometimes this still competition animosity between chiropractors and physical therapists. We work with some great physical therapists, and not only, yes, there is overlap and there's things that we can both do, and maybe they'll do it or maybe I'll do it. But there is areas where there is not overlap. And the physical therapists that I work with, we complement each other so well because I look at musculoskeletal health and wellness as a combination of duct tape and WD-40. And I am WD-40, and especially because I do massage with my adjustments. So wherever things are stiff, tight, restricted, and need to be released, loosened up, oiled, however you want to picture it, that's me, that's my domain. But the other side of that coin is what is unstable, what is weak and needs to be stabilized and strengthened. And physical therapy, at least in my mind, is better at that than chiropractic is. It's more specified towards that than chiropractic is. And if we do both, like you experienced, then you're going to get the full WD-40 and duct tape combination, and it's the best results.
and it really works. Yeah, it could be my personality where I don't necessarily say, "Hey, will you work with this person?" I just say, "Hey, I'm seeing a PFPT. Do you want to email them or would you like me to tell them what we're doing?" Most
And
of the
I always
time.
find we do so much better when we're communicating with each other.
And as a patient, as the consumer, I find that I have just much more well-rounded care when my practitioners are talking to one another. And so it is something that when I'm interviewing, like for example, when I interviewed my acupuncture, I said, I'm already working with a PFPT and a chiropractor. Is that somebody that you would be willing to talk to? I'm happy to sign whatever papers, but I like it when my healthcare team all talks to one another because I find that a lot of times I need to be dipping into multiple places in my healthcare to get the best results. And guys, if you interview somebody and they say, it's not really my style, Me personally, I probably wouldn't see that person. For me, that would be a big red flag that they may not be the best person to put on a collaborative care team. And how I feel about collaborative care, it really will give you the best results. So you want to get with somebody that is open to working with other practitioners and doesn't view themselves as the only expert. An expert for sure, but not the only expert. You want that collaborative care.
The points you're making are so important when you pick a healthcare provider in general, but even more so when you're having a baby.
Yeah.
And it's something that people don't think about when they're interviewing at the very beginning. Are you the right OB for me? Are you the right OB or the right midwife? And there's so many questions that if you knew to ask at the beginning, you'd probably be able to narrow down a practitioner who's much more in line with you, which will make your process more enjoyable and more likely to proceed the way you want it to. And collaborative care is high on the list.
Yeah, oh my gosh, I couldn't agree more. It's something I shout it from the rooftops all the time. I actually feel like a broken record, but I do think that it is one of the most broken pieces of our healthcare system is that medical providers are so resistant and reluctant to work with one another. And I think that it's very unfortunate because the people who actually pay the price are our patients. And it's us, it's the consumers that we're the ones who have the bad outcomes. We're the ones who have the bad experiences. We're the ones who could be having a better birth if our healthcare team would just talk to one another. Okay, I have a question about Webster Technique. It's something that on the internet you hear it a lot. If you're going to see a chiropractor, make sure they're Webster trained. Talk to us about what is Webster Technique? Is it really that important? Should we see somebody that's not Webster trained? What do we need to know about this?
I guess the first thing to know is that anybody who's licensed as a chiropractor is trained and is capable of working on someone who's pregnant.
Okay.
That said, not all of the people who are trained as chiropractors are comfortable working on people who are pregnant,
Okay.
and not all of them who are comfortable have experience working on people who are pregnant. And if you want somebody who's going to give you the best care for your pregnancy, you generally want someone who has signs that indicate that they have a lot of experience with pregnancy and that they know what they're doing. One of those signs could be Webster certification, which is offered through the International Chiropractic Pediatric Association, which is an association that does a lot of research about pregnancy and chiropractic and pediatric care in chiropractic. And they publish a lot of that research, and they also do trainings, postgraduate trainings for chiropractors. One of those trainings is the Webster Technique, which was developed by Dr. Larry Webster in the 1970s. He was looking at intrauterine constraint. So, why do some babies move around more freely in the womb and can find their way into a great pre-birth position, and other babies seem to not be able to do that? And all his investigation and research led him to come to two conclusions on things that you can do from a musculoskeletal perspective. Basically, you're working not on the baby directly, but on the baby's studio apartment and giving the baby a little more flexible room in that studio apartment by releasing two things that he identified. One is the round ligaments and one is the sacrum. So the round ligaments anchor the uterus to the pubic bone. And they have a really interesting job because normally a ligament is a stabilizer in the body. It connects two things together, usually bones, and it's going to prevent those bones from moving too far apart from each other. So before we talked about restriction, where bones don't have enough movement, you also don't want them to be overly mobile, hypermobile, and move too far apart from each other. That also creates problems. And the ligament is literally just a piece of rubber band that connects those two bones. It can only stretch so far, and it'll prevent the bones from approximating too far away from each other. And the round ligaments have a weird job because they need to let the uterus grow like 100 times its original size, but also anchor it to the pubic bone and not let it swing around too much. And that kind of creates a more protective space for the baby. So how do you do that? Well, whoever made them had this great idea. Let's make these ligaments very loose and able to stretch a lot, but also we'll put muscle fibers in them. Most ligaments have no muscle fibers. The round ligaments do. And so if they detect a quick movement, those muscle fibers will engage. They'll shorten, they'll contract, and they'll make the ligament pretty taut in its connection to the uterus and to the pubic bone, and so they'll prevent it from swinging around. Now, sometimes, especially towards the end of pregnancy, those round ligaments can be pretty tight and limiting in a way that's not productive to the baby's ability to move inside. And he addresses that by stretching those ligaments like you would any other muscle fibers that are too tight and causing relaxation to those round ligaments so that the baby has more functionality underneath them, more mobility, no restriction from that tension. The other thing is the sacrum, which is the foundation of the spine. It's a triangle-shaped bone at the bottom of the spine under the last vertebra, and it's the foundation of the whole spine. And it articulates, it meets up with the hip bones that come from either side. And there's a good amount of movement that should be taking place there that affects the whole pelvis. And so sometimes it's moving fine on both sides. Sometimes it's stuck on one side or stuck on both sides. And so part of the Webster technique is an assessment of the sacrum and its mobility and a correction. So if it's stuck on one side, you adjust that side. If it's stuck on both sides, you adjust both. And if it's moving really well, just leave it alone. But that combination around the front and back is designed to give a more functional environment to the baby that's living in that studio apartment. And so people often think about it in relation to breech. It's not necessarily a breech turning technique. I can tell you a lot more about how it and the work that we do are meant to help breech babies get into a better position. But it's something we do on anybody who's pregnant and needs to have good functionality in her spine and pelvis in particular, and to improve function in the muscles, bones, and the ligaments is really valuable.
Okay, I definitely want to hear about the breech baby because when you were talking about the ligaments being tight at the end of pregnancy and maybe restricting the uterus from being as spacious for that baby, my mind automatically went to two places: breech baby and asynclitic baby. So, talk to us about how chiropractic care can help maybe not turn those babies, but make more room for those babies, is what it sounds like.
Asynclitic baby is how I got into doula work, which I'll get to
Ah.
second. Breech baby is something I do in my office every single day. First of all, I was a breech baby back in
Oh.
1974. Nobody cared that I was breech. My mother says they didn't even know I was breech till I started to come out. If you ask my kids to reenact my birth, they will scooch forward and wiggle their little bum through the doorway. Now, of course, for reasons that could be its own episode, the accessibility to deliver a breech baby vaginally is very limited in the United States. And so it becomes a much bigger deal. If you have a breech baby and you want a vaginal birth, how do you get that baby to go head down? Medically, they can try to force it, but long before 37 weeks, when they do that, there are things that you can do at home. And one of them is working on the musculoskeletal system. So my premise with breech babies is that babies want to be head down at the end of pregnancy. And that is based on statistics. So in a first pregnancy, the statistics roughly play out like this. At 28 weeks, approximately 50% of babies are not head down. And at 32 weeks, just 4 weeks later, approximately 10% of babies are not head down.
Wow.
So there's a massive migration between 28 and 32 weeks in a first pregnancy where babies just start to move head down. And that also coincides with when they start to run out of room in the womb. So at 28 weeks, it's not 50% are at the top and north and 50% are at the south, and they're looking at each other. They're in constant flux. They're moving around a lot. And if you take a snapshot, you're going to find approximately 50% are not head down yet. But as they run out of space, as they have to pick a position, they start to move head down because that's generally the most comfortable fit for a typically shaped baby in a typically shaped uterus, and also the easiest way to get them out. So it works out well for everybody. At 32 weeks, you have 10% breech. At birth, it's more like 3 to 4% breech. So from 32 weeks to the end, that number keeps going. Babies continue to migrate downwards, and then you're left with about 3 to 4 out of 100 babies that are breech from 37 weeks and beyond. Now, based on the premise that babies want to move head down when they run out of space at the end of pregnancy, when they don't go head down, there's generally a reason for it. Sometimes it's structural, sometimes it's functional, could be a combination of both. And once in a while, we actually have no idea. Even after doing a C-section, we look around and can't find any clues why that baby was breech. Structural things could be, let's say, the shape of the uterus. The top is normally rounded. A common variation is if there's a divot, if there's a little septum that comes down, and it creates the cartoon heart shape look. And the head could get stuck on one lobe of that cartoon heart, and the butt is down, and the legs come up on the other side. It could be pretty hard to get past that septum. If you turn one way, the head bumps into it. If you turn the other way, the legs bump into it. And the shape of the uterus may not just even be conducive geometrically for the baby to want to go head down. The incentive actually might be to go head up. The placenta, especially if it's on the front wall, can get in the way in a similar fashion where either the head or legs can't get past it, or maybe the placenta is high up and the cord is short. So as the uterus keeps moving further away, so does the placenta. And then that short cord, the baby's going to naturally move up and be close to the placenta. That's where all the snacks and meals are coming from. It's certainly what I would do. And that baby should be there and will stay there. And it's the smart thing to do. Sometimes the cord is long and maybe they get wrapped up in it in the movements of the first trimesters, and now not dangerous generally, but hard to move around. And also the fluid makes a big difference. There's a very big range of normal fluid, quote unquote normal, on the amniotic fluid index. It's somewhere around 7 to 25 is all considered normal. So as long as you're over 725, we're not medically worried about the pregnancy, but the more fluid there is, the more space there is to move around. If you have 7, 8, 9, 10, that could be a baby that's really stuck in there, just wedged with no way to turn. Sometimes you're all the way up 18, 19, 20, all the way up to 24, and you just have a really generous swimming pool. And so even though you've crossed 32 weeks, your baby's not running out of space. So they're still moving around like it's 28 weeks. And those are all structural things that I can't do anything about. But functionally, the low back, hips, and pelvis are supposed to be very loose, relaxed, and open at the end of pregnancy. The body tries to do that hormonally with hormones relaxin and elevated progesterone. But if where the bones come together or the soft tissues like the muscles and tendons are stiff, tight, and rigid, even though the ligaments are loosening up, those other tissues may not be. And so if you have a lot of stiffness, tightness, and rigidity at the bottom when the baby runs out of space, it very well could be the incentive is not to move down into the pelvis, but to bring their head up under the rib cage where there's more space. And even if the baby's trying to move with all that rigidity, the body may not be able to accommodate the movement, so it just resists the movement. I don't do anything to the baby. I just work on the body. So I use the techniques from Dr. Webster, loosening up the round ligaments and adjusting the sacrum, but also with my massage background, we do a lot of work loosening up the muscles all along the spine. And the lower we get, the more specific, the more time we spend. The quadratus lumborum, the muscles of the lower back, the gluteal muscles, the piriformis is a huge one, deep underneath the gluteals. That's a hip rotator that sometimes is very stiff, tight, and rigid at the end of pregnancy, restricting mobility. And then in the front, not just the round ligaments, but the hip flexor tendons. Sometimes from really strong workout mamas, the abdominal muscles are still very engaged and tight. And so it's about loosening up all that. Sometimes under the rib cage, there's tightness in around the diaphragm and we try to just clear that whole flight path so that the baby has more incentive to want to go head down, and that if they're trying to move, the body will be better able to accommodate the movement.
Yeah. Oh my gosh. Okay. I want to hear your opinion on breech birth. Are you scared of breech babies? Do you believe that breech is a pretty normal thing? Do you believe that breech should be widely available? My audience knows that I'm very pro breech birth with a trained provider. And like you mentioned earlier, it's hard to find that. We have some mutuals, Dr. Stu and Dr. Rick DeFries, and I've attended Dr. Nathan Riley's conference for several years now. So pro breech birth on this side, where do you stand on that?
Pro-choice. So I think that breech is like anything else. It's a risk. Nothing is risk-free. When you give birth, there's no risk-free way to do it. There are a lot of options, and for each option, you would be best, I think, to explore the pros and cons of each option. What are the risks? How likely are they to happen? What are the consequences if they do happen? What are some of the ways we can mitigate those risks? And what are the alternatives? And for those alternatives, same set of questions. We all do that all day, every day. I get into my car and I know in my mind that there's risk that I will be hit by an 18-wheeler and never make it to my destination. But I also know that the odds of that happening are pretty slim. I mitigate it by having a seatbelt and by having an airbag and by driving carefully. And I also realize if I want milk and eggs, I'm going to have to get to the store. So it's a benefit that I'm willing to take that risk for that benefit. And we do the same thing in healthcare all the time, and obstetrics is no exception to the rule. So the problem really, I think, occurred for me in terms of, if I'm a fan of choice, occurred in 2001. And in 2001, I think we asked a legitimate question. And the question is, now that cesarean birth is pretty safe, who's better off having a cesarean birth versus a vaginal birth? So when cesarean birth first started, it was grossly unsafe. We only did it if the mother and baby were both at risk, and if we wanted to try to save one of them, we would do a C-section, and could only at best reliably save one of them. And then even after it got a little bit better, it was still not great. Like you would lose your uterus. It would be a radical cesarean. And then it started to get better and better. Our understanding of germ theory and infection changed, and that was a big step. The way that we do incisions and stitching, suturing became much better. And flash forward to 2025, it's a very safe procedure. Does not mean it's risk-free, but it's a very safe, reliable, predictable procedure. It's done all the time. It's probably one of the most performed surgeries in America. And when it got to be that level of safe, it's reasonable to ask, okay, there are certain complications that can happen in a vaginal birth, and some babies and mamas are more at risk for those things happening. Would we be better off just doing cesarean with those categories of people? For example, if the placenta is fully blocking the cervix and the baby has to smash through that placenta to come out vaginally, I think pretty much everyone agreed that a cesarean is a better shot. And so thankfully we have that option. If there's an active STD lesion, should we bring the baby through that birth canal, or maybe better off to avoid that? In 2001, a study came out that posed the question, what about breech babies? Because when you give birth to a breech baby vaginally, certain complications can happen that generally don't happen with head down babies and don't happen with C-sections. Two of them are if the whole baby comes through, but the head gets stuck. So with a head down baby, if they get stuck, nothing comes out, and then you go do a C-section. But if you have a breech baby, the legs can come out, the body can come out, and the head comes very close but gets stuck in there, and the lungs are starting to inflate and they're in a liquid environment. It could be a really serious complication with very little to do at that moment to overcome that complication. The other one is umbilical cord prolapse. So let's say the umbilical cord comes through the cervix from the womb to the birth canal, and then the baby pushes into it and compresses its own cord, and they're cut off from their oxygen and everything else they need to survive. Also a very potentially serious complication. And so the term breech trial, I'm going to simplify it a bit, basically took 2,000 women and they had breech babies, and they agreed to be randomly assigned to either we're going to try to deliver you vaginally or we're going to try to deliver you by cesarean. And they looked at the outcomes. I say try to because some of the vaginal babies ended up born by cesarean and vice versa. If you just went into labor quickly and labored down your breech baby and didn't have time for your C-section. But generally speaking, they looked at the outcomes for the mother and baby right after birth, and they found the mothers were about the same. No statistically significant difference for them, but for the baby, they found a small but statistically significant better outcome for babies. And so based on that one study, this is where things go south. Based on that one study and that small but statistically significant finding, and pretty much immediately, the United States and Canada made the recommendation that all breech babies should be born by planned cesarean. And you generally, I don't think it's a good idea to do that based on one study with a sample size of 2,000 people. I don't think it's a good idea to take away the option. You could maybe make a recommendation that we think this might be a better way for many people, but to take away the option, essentially, it wasn't outlawed, but it was pretty firm. All babies should be born by planned cesarean. That quickly was a bad idea. And for example, some of the things that the study, flaws of the study, were that it was done in many countries, some of them in facilities that do not have imaging, high-tech imaging, so you couldn't do proper selection. Who is a baby that's a better candidate for vaginal breech birth and who is a less good candidate? So for example, if I'm worried about head entrapment, even without imaging, if somebody's had two 7-pound babies vaginally with no complications and babies didn't get stuck, the third one is extremely unlikely to get stuck too, even if it's breech. That's a whole different category than somebody who's never had a vaginal birth. And so if I took 2,000 people who had two vaginal births, and now they have a breech baby, I can almost promise you that the outcomes are going to be much more skewed and better outcomes from a vaginal birth than cesarean birth, but we didn't do that kind of selection. And the choice disappeared anyway. If I'm worried about babies coming through and the head gets stuck, there's ways to mitigate that too. Not just if it's your first baby, there are still things to look at. How is the head positioned? Is it flexed or where it's more likely to get stuck, or is it not flexed and able to maneuver as it comes through? How big is the baby? If you're measuring for a 12-pound baby, I'm not a big fan of fetal weights, but if you're looking at a gigantic baby, then maybe it's not the best option. Again, your choice, but there are selection things that never happened. When you're worried about the cord coming through first, the umbilical cord prolapse, it doesn't happen with head-down babies because the head blocks the cervix, so nothing can come through until the head comes through. Certain types of breech baby have that advantage as well. If the butt is engaged low, then it's going to block the cord as well, and you don't really have to worry about cord prolapse like you do if, let's say, there's just a foot down there that doesn't occupy the whole space, or nothing, the baby's just floating. So selection wasn't done, but the option was taken away anyway. Those facilities, some of them had practitioners that had very little skill or experience with breech babies, confidence in delivering breech babies. Many of them did not have NICU and options for the baby if the baby would need medical care after birth and more advanced medical care. And so you can't extrapolate that to, let's say, the hospital I'm looking out my window right now that has an incredible NICU and doctors who are skilled still at breech birth and the ability to do selection and then make a decision based on that. And to get back to my question, do I believe that the choice should be available? Absolutely, yes. I think the study was an honest study. The aftermath of the study was something that we see, unfortunately, frequently, where options just get pulled away. 2 years later, of the babies that made it, quote unquote, they did a follow-up study and found no long-term difference in health in the babies based on mode of delivery. But what they did not do is a follow-up study on the next pregnancy for that mom. And so the risks that go up to a pregnancy alone, like a placenta nestling itself into scar tissue from the original C-section and the complications that can come from that, or the fact that now you have to choose in the second pregnancy, are you going to do a vaginal birth after cesarean or a cesarean birth after cesarean, neither of which is as uncomplicated as a vaginal birth after a vaginal birth. So those studies weren't done. In that way, I think it was a little short-sighted and misleading. 4 years after the study came out, a researcher named Glazerman put all these critiques of the study together and suggested that the findings be revoked. And it was after that that the United States and Canada both updated their policies, their recommendations, to say, you know what, vaginal birth could be a reasonable option if you can find a provider who is skilled and confident at it and still offers the option. By this point, of course, there are whole classes of medical doctors who had been through medical school, through obstetric training, and never once seen a breech birth, have no training it, no comfort with it. It is by far not the community norm anymore in the United States. And whenever you go against the community norm, you're taking on extra liability, which is risk to the practitioner or the facility, does not mean increased risk to the mother or baby. But for all those reasons, the option has disappeared. And I think it's really tragically sad. But it puts a lot more pressure on people that want to have a vaginal birth to try to figure out ways to get their baby to go head down. And sometimes even when the baby needs to be head up.
I'm a big fan of saying that sometimes our babies know things that we don't know. And it's just like knowledge that we're not privy to, and we can trust them on that. It reminds me a lot of the Arrive trial, how the 39-week Arrive trial had. I also think that was an honest study, but it had some serious flaws, much like the term Breech trial. And it was just pushed out and disseminated across our country like wildfire. And even though it's been debunked now, and we know that it is not applicable to every single pregnant person at 39 weeks, we still can't get providers, A, to admit that, and B, to change their practice and to change their recommendations and instead offer it as an option rather than offer it as an absolute.
Yeah, and everyone's different is something that we repeatedly fail to take into account. We, I think, did an excellent job breaking down the Arrive trial on Informed Pregnancy podcast in an episode with Dr. Emiliano Chavira, who's
Yes.
just great at breaking these things down and really looking at why was the trial done, how was it done, what were the outcomes, and what do they mean? But more specifically, what do they mean for me individually? And you're right, the Arrive trial is another, but there it almost felt like doctors were making that recommendation anyway. And then when this piece of evidence came out, it was like, here's proof. Everybody has to be induced at 39 weeks if you want to avoid a C-section. And yeah, we break down hardcore why that is not exactly the case.
And how our C-section rate has only risen since.
Exactly. Good point. You had asked previously about asyncliticism. I was at Petco one day on a Sunday, trying very hard not to buy a guinea pig for one of my kids. And I got a phone call from a midwife, and she says, "You do all that like chiropractic and massage work to help make it so breech babies can turn head down?" Yes. Could you do it for a posterior baby? A baby where the head is against the spine, the skull's against the mom's spine. And I said, really, it's just the same thing. We don't turn the babies. We make a functional environment where the baby should want to turn, just like they want to be head down at the end of pregnancy, generally speaking. They also don't want their spine pushed up against mom's pelvis, their head pushed up against mom's pelvis that way. And so they generally do rotate into an anterior position if they can. So I said I would just do the same things. And she says, great, I have a client for you. And I'm like, cool, I have an opening on Tuesday. And she's like, no, right now.
Uh-oh.
I'm like, okay, no guinea pig
I'm
kids.
trying to buy a guinea pig.
Trying not to buy a guinea pig. I was like, tell me more. And she's, I'm at this birth, and this mom has been stuck at 9 centimeters for 9 hours.
Wow.
And the baby's not lined up well, and we're going to have to transport to the hospital soon. But I was just trying to think outside the box. Is there anything you can do? I'm like, I've never quite done that before, but I'm willing to give it a shot. So I drive over there and I come into this house, and it's really weird. My first time being at a birth that is not my own kid is, except when I was a paramedic, but in this type of setting. And it's also weird because I'd never met them before. And so I'm meeting people that have been in labor for over 24 hours for the first time. Equally weird, nobody told me they were filming for a documentary. So there are six cameras around the room filming everything. Extra weird, she's high as a kite on her own oxytocin and other self-made drugs. And I'm trying to do informed consent, like, hi, I'm Dr. Berlin, and this is what I do. And I'm a chiropractor. I'm going to release these muscles with massage and these bones with adjustments. And is that okay with you? And she looks right into my eyeballs and she says, I love you, Mr. Berlin. And I look right in camera too. I'm like, does anybody know if that is informed consent? Is that, yeah, does that work?
Does that count? Is
Yeah,
that a
does that
yes?
constitute informed consent? Anyways, so we did it, and you could just feel she was super rigid, super tight, very athletic, and just also strong is amazing, but when strong and tight come together, it's just very rigid. And so I eased into it. I'm working on her, slowly loosening things up, and she's in a great mind space. Like she's really riding the waves of the surges. It was so beautiful and inspiring. And again, just a lot of oxytocin. She's in a great place, and she's loving the massage and loosening up. And it took, I would say, about 2 hours until all of a sudden there was just a moment. I could feel it in her sacrum, just a clunk. And she cussed and she said, I think you just saved my birth.
Oh my
And
gosh.
within 40 minutes, the baby came out. And from that point, it just like the car was in neutral, the contractions were happening, and no wheels were spinning. And then boom, into gear, and that baby came out. Now, I think actually Dr. Stu ended up at that birth too. Now, after that, people started calling. My client's in labor and she's got really bad. It's really painful at her sacrum. She's having back labor. Can you help us out? And so I started running to all these different births. And eventually somebody said, my friend Rachel said you massaged her for 3 hours while she was in labor. Can you come to my birth and massage me while I'm in labor? And I was like, Rachel's baby was stuck. And she's like, why do I have to wait for something to go wrong? And I was like, touche, you don't.
Good
And
point.
so I ended up for the first time at a birth of somebody, it was a totally different experience. No cameras, somebody who I had met and worked with during the pregnancy, which was much more comforting, pre-arranged informed consent, very good. But also nothing was quote unquote wrong. And just using massage and touch and release of things that are tense to help her find her confidence and a rhythm and feel safe and start releasing that oxytocin was an incredible thing to be a part of. And then that just exploded as more people were like, hey, can you come to my birth? I just felt like maybe doula training would be helpful, have more tools in my tool belt, be better suited for being in that environment. And once I was doing it, my wife did it too. And we became probably one of the only husband and wife doula couples I can imagine. And it was a great ride. I stopped doing it after COVID because in the year that followed COVID and beyond, so many people here started to have out of hospital birth that weren't really out of hospital birthers necessarily, but also didn't want to be in the hospital. And so oftentimes they would need a lot of support and want a big
Hmm.
cast of characters that show up to a birth with a giant, I'm thinking of one with doctors too, especially now, with a giant welcome mat, and there's no room for my shoes because of all the people that are already there. And it was a lot. And I was doing birth at nighttime and I'm in the office like 10, 12 hours a day and I was just burning out. So I don't really do it anymore, but it was a magical time and just an incredible honor to be invited and to witness and be a part of that.
Yeah, it always is. We talk a lot in this community about birth as a sacred space and it should be an invite only event. I've been to births too where they have a whole list of invite only people that they want there, but I do believe that the smaller the crowd, the better your birth will go in general. It's a very inward, personal experience. And if you can sit with that, I just think that you will bring out that magic. Dr. Berlin, we could talk all day, but of course, I want to be respectful of your time. I do have one last question before we wrap up and before I ask you where people can find you. But why do you think that fetal positioning is largely ignored in the traditional medical model? As a doula who has practiced for the last 10 years, I've traveled to many states, even we've had births outside of the US and other countries think about fetal positioning. I'm thinking about a birth in Germany specifically, and it was with midwives, not an OB, but the whole pregnancy, we talked about fetal positioning. And in labor, it was a very large part of the conversation. In the US, some providers will talk about that, but largely it is ignored and it is almost not part of the equation that they think about at all. Why do you think that is?
It's a great question. I think when it comes to midwives, they're more likely to focus on it, and obstetricians less likely to focus on it. And I think that there's probably a couple of reasons for it. Like even when it comes to breech, I beg my clients, find out what position your baby's in at 32 weeks. Because at 32 weeks, it's not a panicky time. Like I said, statistically on a first pregnancy, 10 out of 100 babies are breech, 10%. At birth, it's going to be more like 3 to 4 out of 100. More than half of those babies will turn even if you do nothing. But when we start doing early intervention, it's more like 90+% end up turning. And so if there's something you can do about it, you can only do it if you know that it's a thing. And so I always say check for breech at 32 weeks. Now, doctors oftentimes don't want to. And again, I don't always think it's malintent. I think sometimes they're like, why would we make somebody nervous about breech if there's nothing we can do about it? And in the medical sense, there is nothing they can do about it because the thing they do, if they even offer it, is an external cephalic version, which is manually forcing the baby to try to turn. And they don't do it till 37 weeks because if they're one of the risks is that the water will break or you go into labor and they don't want the baby to come before 37 weeks or it'll be premature. So in their mind, there's nothing that can be done. And again, if you're not working collaborative care, full circle here, then there's nobody else on the team that maybe could do something earlier on. But we know there's a lot of things you can do earlier on, just in our realm, chiropractic and massage. There's spinning babies, there's acupuncture and moxa. There's a lot of different things. There's pulsatilla, the homeopathics, a lot of things you could potentially do to try to give your baby the best opportunity to move that you wouldn't know to do if you didn't even know that you had a baby that needed positioning help. And so I think it's oftentimes something that they don't look at because they don't feel like there are any options until the very end. And of course, when you find out your baby's breech at 37 weeks, you have very little time to do anything, to react to it, to explore what the options are. And for that reason, I think again, not malintent that they don't want to scare people, and neither do I. But I do want to give you information and say at this point, 90% of babies are head down. There are certain things to do if you want to try to help or encourage your baby to get into a better position. And from the medical doctors I work with, there's a lot of resistance to that because they're not familiar, they're not working in a collaborative way. And in their minds, there's nothing that you can do until 37 weeks.
Yeah. Oh my goodness. You're just speaking directly to my heart. This is a conversation I have with all of our clients that have breech babies. I'm like, if we can start now, we will improve our success of turning this baby. And Also, you don't have to be scared of a breech baby. We still have options, even if your baby stays butt down or feet down. Oh my gosh, Dr. Berlin, truly thank you so much for joining me. This has been such a fascinating conversation, and I know that so many people out there are finding a lot of comfort in this. If people wanted to connect with you and they wanted to learn more from you, they wanted to hear your podcast or get connected with your platform, how can they do that and where can they find you?
First of all, I just want to say thank you for having me. I could talk to you forever. Like your passion and your curiosity and thoughtfulness are just so lovely and refreshing. Thank you.
Thank you.
We have a few things. Informed Pregnancy Media has two podcasts, the Informed Pregnancy podcast and a brand new series called One Way or a Mother, which is a deep dive into a birth story. Each season is one story told over an arc of 10 episodes in a very kind of thoughtful and analytical way where the mom is supported by the people around her and the story is told from all of their perspectives. So that's One Way or a Mother. And then our streaming platform, Informed Pregnancy Plus, the goal is to take as much streaming video content as we could. Our two documentaries, one on Breech called Heads Up, The Disappearing Art of Vaginal Breech Delivery, the other one on VBAC called Trial of Labor, but also dozens of other films, really great content, and a web series. We're just producing one now called The Fourth Try, all about postpartum and how to get ready for a more smooth postpartum transition, and other web series that we license, and fitness, mind body fitness, yoga, workouts, belly dance for birth, meditations, sleep, and a whole bunch of workshops. All of it is that streaming is on informedpregnancy.tv if you just want to get it off the web. But we try to make it super accessible. So there are apps for Apple, Android, Roku, and Apple TV. You can stream it any place. The best way to get started probably is just go to informedpregnancy.com. Everything is there at informedpregnancy.com.
And I'm a member, you guys. It's where I get a lot of my education, and I love the community there. And I find that it is much like the Birth Lounge community. It's just unbiased. It really puts you in control of the decisions that are made. So definitely check that out. Dr. Berlin, thank you so much for being here. You guys, I'll see you in the next episode. Be sure to connect with Informed Pregnancy on social media and on their platforms. And you can find me at Tranquility by Hee and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye.
Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm Hee, and this is the Birth Lounge Podcast.